Let's go to Tema now, where the Minister of Employment, Ignatius Bafwewa, is currently addressing the press as the world marks Safety Day today.
Had to be transferred to Gabon to go and practice his trade there on behalf of the organization. He got to the airport, and in moving from the airport to their official residence, their car was involved in an accident. This guy has ever since been incapacitated. All other 3 persons that were on the same vehicle with him lost their lives. Such are the plights of workers. I must admit that if I want to go on, I can mention so many examples of these things. So, in other words, what I'm trying to say is that issues of occupational health and safety are real. They are issues we cannot delay in having attention for. So it is good the organizers are drawing our attention to it. It is now, and it should never wait till any future time. I was having a chat with a colleague who works for some other organization in government. We had traveled from Kumasi to Accra in a local aircraft. When we landed, he asked, "Honorable, have you thought of one thing?" I asked him, "What is it?" The airport company, do they have a safety plan in place? Assuming we should walk to their offices right now and ask them, "Ghana Airport Company, show us the safety plan for Kotoka International Airport." Would they be able to show us some? I guess you know the answer. Permit me just to use some few examples. I haven't been to your site. If I'm wrong, forgive me. If you go to Unilever plant here in Tema and ask that you want to see the safety plan there, I don't know whether they will have or they will not have. And I want to believe that it is so with so many of our organizations. Maybe because we do not have high incidence of accidents in our country, we play down on the importance of issues of occupational health and safety. There are cases of people developing asthma, which perhaps are the results of fumes they have inherited or inhaled at the workplace. There are even cases of people who are not necessarily employees, who are not necessarily employers of organizations that undertake certain actions, but perhaps are third-time beneficiaries. Let's take the case of construction sites, when roads are being constructed within communities. Sometimes you see workers using, how do we call it? Maybe you can help me. Nozzle. Some use goggles, others use nozzles to cover, masks to cover their nose. But hardly do we even also remember that the dust can also even affect people who are living nearby, yet we don't even care for them. Occasionally, we will go and water the road and give them temporary relief. So these are some of the examples of rare cases of occupational health and safety issues that I think today, having had an opportunity, we should draw the generality of Ghanaians' attention to it. So coming back to my text, His Royal Majesty, it gives me a great pleasure to be part of this year's commemoration of World Day for Safety and Health at Work. Safety and health at work over the years has been a major concern for many countries, especially developing countries like ours, where standards and compliance remain critical areas of concern and intervention. As a sector that has a mandate of regulating the world of work to ensure decent work outcomes, We are very grateful to the ILO for dedicating this year's discussions to the optimum collection and use of data in promoting occupational health and safety, and also renewing its commitment to support member states' efforts to strengthen their capacity to prevent occupational accidents and diseases, including through practical measures. In his address commemorating this day, the Director General of the ILO, Mr. Guy Rader, emphasizes that countries that have good data will be better placed to fulfill its commitment to implement and report on the global plan of action to end poverty, protect the planet, and ensure prosperity for all under the UN 2030 Agenda for Sustainable Development. Your Majesty, the increasing incidence of work-related injuries, diseases, and casualties in Ghana lay bare the challenges government face in improving its efforts in the area of occupational health and safety, and remain one of the measures that seeks to protect the labor force and the country's scarce human resource. Ghana, being a member of ILO, has ratified a number of labor-related conventions, and even though we are yet to ratify the ILO Convention on OSH, the ministry and its social partners have been overly concerned about the need for a comprehensive policy framework to address the issues accounting for high incidence of occupational injuries, diseases, and casualties at the workplace and workmen compensation. Nana Chair, we sincerely acknowledge that data collection has been a major challenge, and this continues to impede development in consolidating the gains in improving health and safety at workplace. Lack of accurate and reliable data does not support informed decision-making for policy and development planning. Figures from ILO indicate that an estimated 2.3 million fatalities and 300 million accidents causing injuries occur in the workplace each year. However, these estimates do not properly reflect the magnitude of the problem, nor the real impact of occupational accidents and diseases on workers, families, and economies. Better national data is needed for a better understanding of the dimensions and consequences of work-related accidents, injuries, and diseases, and also to help us effect policies and strategies that will help promote safe and healthy life at the workplace. Nana Chair, this forum presents an opportunity to engage in healthy exchanges of ideas and ways to ensure that our nation's workforce stays safe and healthy on the job. Ghana has had its unfortunate share of occupational accidents, including road traffic crashes, manufacturing industry mishaps, and construction and service industry injuries due to the sheer negligence of safe practices. Over the years, Ghana has lost a significant number of scarce human resources through occupational accidents and diseases. Between 2000 and 2016, 272,689 accidents were recorded on the roads in Ghana, with 29,808 deaths and 146,504 injuries. The National Fire Service recorded 2,587 fire outbreaks, with 1,108 people losing their lives and livelihoods. Every year, some 2 million men and women lose their lives through accidents and diseases linked to their work. Nana Chair, we will recall with heavy hearts the June 3rd twin disaster in 2015, the recent gas explosion at La, the Kintampo waterfall tragedy, and the latest being the unfortunate inferno at the Coconut Grove Hotel, just to mention a few. When we look at the accidents at our workplaces, we must not think of these as isolated accidents or random events. Collectively, these are public and worker safety and health issues that point to a disturbing pattern of neglect our country has tolerated for far too long. Government cannot reverse this deadly trend alone. We need the support of workers, employers, safety organizations, private sector, and trade unions, among others. It is for this reason that I express my sincere gratitude to the organizers of this event, especially Department of Factories, Inspectorate, and the Ghana Institute of Safety and Environment Professionals in bringing together all relevant stakeholders to commemorate this all-important day for labor protection. Indeed, we are grateful to you. Nana Chair, on our part as government, and in response to ILO Recommendation 164, 1981, and 197, 2006 on OSH, the ministry will continue to strengthen its regulatory role and offer leadership and direction for the way forward. We are also concerned about the fragmented frameworks, and as a result, we are hopeful that the draft OSH policy and bill placed before Cabinet will be approved for a more responsive OSH management system in Ghana, particularly in the informal economy where vulnerabilities abound. Nana Chair, ladies and gentlemen, neglecting the safety of our workforce is not an option, and therefore we need a more concerted effort to the call for more effective protection and compliance in OSH, which invariably has a positive effect on productivity and performance of any organization. It is my personal commitment as a Minister of Employment and Labor Relations to institutionalize periodic visits to workplaces and establishments to ascertain for myself their readiness and compliance to labor issues, including OSH. So I want to believe Ghana Employers Association is ably represented here. They should not be surprised. One day they will be at their factory site before they know I'm there. And I will not let you know when I will come. I will come with my team, the factory inspectorate people will be there, the labor people will be there. We will come and look at your workplace and see how best you are taking good care of the people you engage in your business. Now, it is my hope that beyond research, which remains extremely important, stakeholders, including but not limited to government, private sector, worker groups, employers, and civil society organizations should commit enough human and financial resources to OSH to complement policy initiatives and enforcement strategies. Above all, I urge all of us here to advocate for significant investment in data collection to facilitate informed decision-making for policy planning and development. Nana Chair, before I resume my seat, I was one following a vehicle which had this inscription on it. It reads, "If you think education is expensive, try ignorance." So this morning when I was coming, I was reflecting on how to relate that to what we are coming to do here. And then I said to myself, okay, then I will also turn it this way, that if you think OSH is more expensive, then try workman's compensation. And that one will be far more expensive. Thank you.
Thank you very much once again, Honorable Minister. I would like to acknowledge the presence of Mr. Emmanuel Abuanodoti, Coordinating Director of the Tema Metropolitan Assembly. Supported by Gasem Rico Limited, Temalu Oil Company Limited, and then Tema Fuel Company Limited. Thank you.